After the U.S. House passed a health care reform bill last night, healthcare providers, businesses, and individuals across the country are wondering, what does it mean for them?
And West Central Indiana is no exception. Kristen Majorano joins us now with more local reaction. Kristen?
Jeff, people are definitely talking about health care today. It's a trending topic on Twitter, and we've heard from several elected officials as well. Overall, the reaction is mixed. Local health care providers say they're still trying to learn exactly what the bill entails.
The devil's in the details, and we don't know the details yet.
But St. Elizabeth Health CEO Terry Wilson says the details they do know leave him with a few questions.
We won't start to see more people covered, we think, for 2 or 3 years, while some of the cuts in reimbursement that are going to be used to pay for this bill will happen very soon.
Wilson says he's concerned about planned cuts in Medicare and Medicaid since those programs already fail to pay for all of the health care costs at St. Elizabeth. But he says it's a step in the right direction toward expanding care to those who need it, a thought that is echoed at the Riggs Community Health Center in Lafayette.
We are encouraged as a health center movement that the administration does see health centers as a value.
Riggs Community Relations Coordinator Stephanie Bossing says health centers nationwide are excited about the prospect of more funding, but like St. Elizabeth, they also have some concerns.
In Tippecanoe County, we have we're known as a medically underserved area. There is a shortage of providers in our area. And so we want to make sure that there are enough providers for enough people who have the coverage.
Many Indiana elected officials take a stance that's not quite as middle of the road. Governor Mitch Daniels said today he can't remember being more discouraged. And Congressman Steve Buyer called the legislation an anti-jobs, anti-taxpayer, anti-Indiana bill.
I am hopeful that they'll remember in November and just throw these people out in Congress. I have never been more disgusted with my colleagues than I am right now.
And in terms of the economy, one local economist says we will see an impact from the bill. I spoke with Purdue economics professor Kevin Mumford. He says although the Congressional Budget Office declared the health care legislation as budget neutral, most economists agree that's probably not the case. He says it will definitely include some form of increased taxes sooner or later. And in the world of economics, increased taxes means lower economic growth. But despite the House's passage of this bill, opponents are not giving up. Indiana Attorney General Greg Zoeller says he plans to challenge whether the health care bill is even constitutional. He says the requirement that all Americans purchase health insurance or pay a fee is unprecedented. Zoeller says it's the first time in history where the federal government has required Americans to purchase a good or service to live here. State Senator Brant Hirschman is also pushing for Zoeller to challenge the health care bill's constitutionality. Zoeller says attorneys general in at least 13 other states also plan to challenge the legislation. Kristen Majorano, News Channel 8.